Good afternoon, everybody, and welcome to the Mental Health in the Workplace, Understanding the Importance and How to Support Your Employees webinar. I'm Rosie Marino, the Culture and Development Manager here at Westfield Health, and today I'm joined by Kathy Lawson, who's a mental health first aider trainer and an independent health and wellbeing consultant, and I'm really looking forward to hearing her insights on mental health.
Thank you.
Great to have you. Fantastic. So today we're going to hear from Kathy, but also we want you as an audience to get involved as well. So we're going to have some polls and some questions for you to answer. But if you'd like to ask Kathy or I a question, we really encourage you to put it into the chat box, because we're going to hear from you at the end of the session, where we're going to run a Q&A part of that. We've also got some brilliant resources and guides in the handout section, which I can actually, really recommend to you, something that you can pick up and use very practically yourself and implement into your organisation. So have a look at what we've got in there for you. Following this session, you'll also receive a recording of the webinar, and we'll send that out via email. And as ever, we're going to send you a survey, and it'd be really grateful for you to, hear your feedback. It helps us to develop our webinars for the future and put on things that are useful for you. So to set the scene, I want to share some statistics from our recent research report called Coping with COVID. So let's put those back on the screen again here. And the mental health statistics really show that mental health days off are increasing, and actually they went up by 10% in 2020, costing businesses a total of £14 billion. The report found that 1 in 3 of employees said that their mental health has been affected, and it affects their productivity on a weekly basis. The north of England has 76% more mental health days off than the south, so it's interesting to identify that north-south divide. 27% of employees are feeling anxious about work, and 24% are looking for extra wellbeing support from their employer in the coming months. So this research is so important to understand and have a look at, and of course is incredibly important. We've got an expert today on our panel, Kathy, to hear your opinions on why these numbers are going up, and importantly, what we can do as HR professionals and managers in organisations to help our people feel healthy and feel well at work. So I'm going to take those slides off and come back to you now, because I want us to kick off this conversation, because we know that the topic of mental health is ever more prevalent. We're talking about it inside and outside of work. But why do you think it's so important that businesses are starting to put well-being up higher on the corporate agenda?
Well, it's an interesting one, and of course, not to forget that this week is actually Mental Health Awareness Week. So the Mental Health Foundation, every year they run Mental Health Awareness Week, and they've given a theme of nature this week, which is fantastic. So I just wanted to throw that in there. You can find lots of information on social media about that. And I think that it really highlights how important it is for organisations to focus on mental health. And the statistics that you've just put up there, I've seen statistics go as high as £34 billion that it's costing industry. So in case we're in any doubt as to why organisations should be focusing on this, it's because it's costing money. It's impacting on the bottom line of organisations. So it's not just the cost that it's causing, but it's also the right thing to do. There's that corporate responsibility that it's the right thing to do to focus on the mental health and well-being of their employees. Because without doing that, then people don't, we all know, don't we, that when we're feeling well, we perform at our best. And so if organisations are not focusing on that, then they're missing a trick, because if people are going off sick, then they're going to lose their best employees, they're going to have increasing absenteeism, and it's going to start costing money as well. So it's the right thing to do, and it's the economical thing to do. It's the financial right thing to do. So in case we're in any doubt whatsoever.
And do you think it's important that we have got those statistics and those number statistics, so that if we do need to speak to the numbers people in the organisation, that perhaps they'll still have those questions about why do we invest in mental health, that we've got those numbers to back up that argument?
I absolutely, I do. And I think, you know, clever organizations, what they're doing now is they're putting wellbeing initiatives in place, and they're getting the statistics from the back of it, and they're linking their absenteeism rates, their sickness rates, they're looking at the reason for those, and then they're linking it to the bottom line results. So, you know, I think it's the right thing to do. When organizations start investing in wellbeing initiatives, then they want to know, well, is it actually making a difference? It might be the right thing to do, but you also want to know, is it actually having an impact? And what you can do, you can start thinking about, well, okay, we've put in these cycle to work schemes, we've put in different initiatives. How effective are they? Is it actually having an impact on the bottom line of our organizations? Can we create a dashboard? Something I did when I was working as a wellbeing manager for a while, I created a dashboard of evidence of what was happening across the organization with regard to the effectiveness of the things that were happening from a qualitative and a quantitative point of view, so that you've got some measure. So if you're investing in these areas, then you know what the impact is having on your businesses.
And I really like the word that you used there about investing in well-being and seeing it as a longer term business strategic goal, because I think so often we're focused on, you know, yearly plans, maybe we're stretching to 5-year targets, but well-being, of course, is something that's probably over a lifetime that we need to have a look, and it possibly could take another generation to see these changes really implemented and making a difference into businesses.
Yeah, and do you know what, Rosie? I think right now the pandemic has achieved what we've been trying to achieve for years, which is to raise awareness around mental health and well-being. They've achieved it almost overnight, because you only have to put the radio on, put the telly on, and all the reports are that there's now going to be an impact on people's well-being and in particular on their mental health. And we know that when you talk about the statistics on mental health is increasing massively at the moment. And whilst I think you do have to hold statistics with an element of respect and caution, because the media are reporting all of these things, and there's a lot of sensationalizing and a lot of overgeneralizing about what's happening. And if we want to just buy into what the media say, then we're listening to the fact that if we have the AstraZeneca vaccine, then we're all going to have a blood clot. You know, that's the sort of sensational news that's out there, and it's not helpful. It's not helpful. And, you know, you can have people who are feeling a little bit vulnerable at the moment, and maybe their mental health is not great, and they're looking at the media saying the suicide rates have gone up. They're thinking, oh gosh, is that going to have an impact on me? Does that mean then that I'm going to take my own life because I'm being told that the stats are increasing? So the stats are great, they're very informative, but let's hold them with an element of caution as well. So,
and I hear what you're saying there, that, you know, mental health is such a personal journey for every single person, and we do tend to generalize because it's easier to create a vocabulary around it, if I can say that word. But I wanted to ask you actually about how we can start to identify and pinpoint, yes, at a general level, of course, there'll be differences per person, but how can we spot somebody that we think might be suffering? Are there some general tips or advice that you could offer?
Yeah, it's a good question, because also, how do we do it? There's one thing doing it when we're face to face and we're going into the office and we're seeing people, but what do you do when we're operating like this on these type of platforms where you're not actually physically seeing people? So I think that some of the things that I hear about are people are reluctant to have their cameras on, or they switch their microphone off and they start making excuses for, oh, it's a technology issue, yeah, it's not working. Or actually, and you know, I think one of the things we have to be mindful of when we're working in this way as well is not everyone wants you to see what's going on in the background, you know, particularly if they're having to use their bedroom as a room. So we have to be mindful of those sort of things as well. In the workplace, you're looking for what's changed, you're looking for what's different. So if someone normally comes in the morning and they're quite cheerful and happy, and then they come in the next day, or they're coming in consistently really down and a bit mopey, then you might think that's changed, that's not normally them. You know, because one of the challenges with mental health and well-being is what's normal, and what's normal for one person is not normal for another person. So you might notice when we're working remotely that emails, oh, their tone of voice is getting a bit snappy now. That's not normally like them, they're getting a bit curt. You know, that's different, that's changed. So those are the sort of things And I think as well, be mindful of the fact that something that we talk about when we talk about depression as a mental illness, we talk about the smiling depression, because depression is not just what we might expect of people being really down and not coping particularly well and maybe being really tearful and really upset. You can have the opposite. You can have people who know that the only thing they're in control of is how they look. So they can actually start controlling how they look, and maybe they start putting more makeup on or doing their hair and putting nail varnish on. They don't normally do that, and that's just the guys, by the way. You know, it's changing things that are different, and those changes may indicate that things are not okay. Now, I was working with a woman once, and she said, when the red lipstick comes out, my boss knows to be very aware, because he knows I'm not okay. You know, and it's like having this facade hiding behind the way that you look as a way of building your confidence up, perhaps. So, and you know, I could be going on about how do you notice it. One of the things that I always laugh about is the way that we say to people, how are you? And people say, I'm fine. I'm fine. Well, let me tell you what fine really stands for. It means freaked out, insecure, neurotic, and emotional. You know, when people say I'm fine, they're not really fine. You might just want to ask again, are you really fine? Or what does fine really mean? So yeah, so there we go.
A great tip there. And what I'm really getting at from that is that you've got to know your people well enough to be able to identify when changes are occurring, to be able to pick up on when mental health and other things also might be changing. Is that fair to say?
Yeah, absolutely. You need to know your workforce. Yeah, you do need to know what's going on with them. It's good practice now to have well-being reviews alongside your performance reviews, you know, because people don't change. People don't suddenly become bad performers overnight. They don't suddenly become de-skilled, unknowledgeable, and unable to perform or demotivated. So if something's changed like that and it's happened fairly quickly, then having a well-being review, put the performance review on one side. Don't use that to hide behind the fact that someone's actually struggling here. So let's have a well-being review. Let's have a conversation that says, how are you? How are you feeling? And not to be dissuaded by the fine result, the fine response rather, which may not mean anything at all. So,
and Kathy, I wanted to ask you about, you know, how much is too much? You know, we're here to do a job. We're employed by organisations. How much should we be sharing with our managers and with our teams about our personal well-being? Is there a limit?
Interesting question. And you know, I think what dictates that are the cultures that organizations have. It's whether the culture says that it's okay for me not to be okay and to talk about it. So is it okay for me to talk about depression in the same way that I talk about my broken leg or my broken arm, or the fact that I've just had a diagnosis of cancer or some other serious illness? And so how much is enough? It depends. You know, does that person trust the manager enough to open up? And if they do open up, what's going to happen with that information? You know, I remember years ago when I was a wellbeing manager for a while, and one of my employees rang me and she said, I'm going to go off sick now. And I said, oh, what's the matter? I said, well, the sick note will come in and it will say fatigue. I'm fatigued. And I said, well, hang on a minute. I saw you yesterday, and forgive me for saying, you really didn't look like you were fatigued. So is that, no, it's not. No, I'm actually really depressed, but I don't want you to tell anyone. I don't want you to report that. I don't want it on my HR record. And this is the challenge then, because we're not getting a clear picture about what's going on. And that person obviously felt like they couldn't open up enough because they didn't trust that they would not be judged or stigmatized or discriminated against if they actually said, this is what's really going on for me. So I think it varies, often driven by the culture of the organization and the relationship that the manager has with their employees. It's good practice for managers now to think about the well-being of their employees. So
very interesting. And I wanted actually to bring in a question that we've had from an audience member already, and just to remind the rest of our audience, please do pop your questions in and Kathy and I can help to get through as many as possible. But this person says that they said, what about if a member of staff has suffered with mental health before they started with the company and they've never said anything, they haven't told anybody that they're suffering? Is there any advice on how you would pick up on that? So you've never seen that before state.
Yeah, so there's a lot of laws now that are protecting people, so they don't have to declare that they have a mental illness before they start working for you. And then once they are in the workplace, if it comes to light that they are suffering with something, then the right thing is to do is to engage in a conversation with them if they're willing to discuss that with you, and to offer to make some reasonable adjustments. And I think one of the ways to think about this is, what if someone came to work with you for you and they didn't have, say, let's use cancer. They didn't have cancer before they came, and then they developed cancer whilst they were there working for you. How would you deal with that? What would you do? You'd probably say something like, you know what, if you need time off for some chemotherapy or some radiotherapy, then of course we'll support you with that. What is it you need from us to help you go through this dreadful illness? You know, and so when you think about mental illness, it's not that dissimilar, because actually, let's ask somebody, what do you need from us to help and support you? Do we need to make some reasonable adjustments so that you can continue in the workplace, that you can continue contributing? Because with mental illness, the workplace sometimes is a great place for people to be, because it's very containing. They can have relationships with people, and it actually can help them recover quicker, and not to fall into the gap in the same way that you wouldn't say to the person with cancer, you wouldn't say, well, can you just take some time off and you know, you'll be fine. You know, they may not want to do that. They actually may want to be in the workplace. So in the same way with a mental illness, let's not say to people, we just need to take some time off and you'll be fine. Actually, that could make a mental illness way worse, or you know, a mental health issue way worse, in encouraging them to take time off, when actually what they want is for you to they want to be understood. They want some reasonable adjustments to be made, and to be believed that actually this is real and this is happening for them. So yeah, have I answered that question? So yeah, hopefully.
It's that important piece around setting the expectation from the very start when somebody joins the business, that they can bring their full self, full authentic self, warts and all, you know, whatever is going on in your world. To the extent that you want to, this is a trusting, wholesome place where we want people to be true to themselves and authentic, and setting that expectation from pre-interview, through the interview process and through some introduction, those first conversations with people, I think is so important.
Rosie, that's interesting, because Mental Health First Aid England have been running a campaign now called My Whole Self. And anyone can go and have a look on their website and see the information that's there. And they've been doing exactly that, encouraging people to bring their whole self. So bringing their background, their nationality, their history, their language, their experiences, their values, their beliefs, bringing all of them into the workplace, and for that to be okay, whether it's, you know, good, bad, or indifferent. So
brilliant. Well, let's hear from the audience members now. So I'm just going to pop a poll up. We'd really like you to get involved as much as possible. So we want to hear from you. Have you noticed any mental health issues with employees during the last 12 months? And we've got there an option of yes, a lot, yes, a little, no, or not sure. And Kathy, I wonder if you could actually remind us of what fine meant, because I thought it was such a great analogy that you used before.
Yeah, so fine, freaked out. Now, feel free to change that first word. I'm sure you can use your imagination and work out what I mean by that. Freaked out, insecure, neurotic, and emotional. There you go, fine.
That's what it really means.
That's what it really means. Yeah, I think it's just, you know, making that point that it becomes almost like a habit when you say, are you, we do this, we say, are you okay? And people say, I'm fine. Yeah, and you're not actually asking an open question. You're not saying, how are you? You know, and then even when you do say, how are you? And people say, well, I'm fine. Sometimes I say, well, what does that mean? How fine are you? Are you really fine? Because you'll know pretty quickly if you say to someone, well, are you really okay? Are you really fine? You'll know, they'll go, oh, yeah, no, sorry, I was a bit distracted. Or they'll say, oh, thanks for asking. No, actually, do you know what? I have been struggling a little bit. And sometimes people don't want to say anything because they feel stigmatized, or they'll feel like they'll be judged if they actually say, no, I'm not okay. Or you know, we can bring in the whole gender difference here as well, because there's still this issue with men thinking that if they talk about how they feel, then they'll be considered weak. And so it's getting better in a way with different generations. The older generations, when it was all about the stiff upper lip and it would be considered weak and ineffective if I said that I wasn't coping. I think the younger generation are much better at having conversations about how they feel, particularly the men. Now they're much likely to share it. And you've got social media, which it both helps and hinders that process. So it's a good thing, but it's also sometimes it's a bad thing. So
very good. So let's just collected lots of information there from our audience members. Thanks guys for selecting on the polls. So let's just close that down and share these results here. And what we can see is that 28% of the group said, yes, we have noticed a lot of mental health issues with employees during the last 12 months. 63% said yes, a little. 3% said no, and 6% said not sure. Kathy, what's your take on those numbers?
So isn't it interesting? Not sure and no. So is that because people are working remotely and they're working at home and therefore you're not actually in close contact with people, so you don't actually know what's really going on? Is it because people are hiding it? So is it because the culture of your organization is such that people won't come forward? Like I gave the example before about the employee that worked for me who didn't want me to know that it was really depression. So is it that people don't feel trusting enough to come forward and talk about it? So yeah, it's an interesting result there. Certainly 63% are saying, yeah, I've seen mental health issues increasing. I saw some stats, I've got one here that said 1 in 5 people take a day off due to stress, yet 90% feel unable to be honest about this being the reason for their absence. So, wow, yeah, interesting.
Very good. So, you know, the reports, the numbers that we're finding from our research reports, the conversations that we're having, and the audience participation today all says that mental health is big news, and it's really important that we be able to get under the skin of this. So I wanted to kind of move us on to kind of thinking about what we can do. How else can companies truly support their employees' mental health in order to develop this great well-being culture? Could you give us some advice on that, Kathy?
Yeah, I would say, first of all, make it a board issue. So start from the top. So it becomes, make it a board, a board agenda. That's the word I'm looking for. So put it on the board agenda. So it becomes something that you talk about in the same way that you talk about the financials of the organization. So make it important. Put a strategy, put a policy together that outlines what you're going to do around well-being and mental health. That's also good practice to have a mental health and well-being strategy in place now. So do those things. Make sure that your management population are aware that this is important as well, because again, it's good management practice for managers to make sure that they are thinking about the well-being of their employees, and put some investment behind it as well. And you don't have to invest a lot to start, for example, putting fruit bowls in the offices for people, putting other initiatives, organising walks at lunchtime for people. It doesn't have to cost a lot of money, but it does send a clear message that, oh, this is important. Actually, we're now starting to think about the well-being of our employees. You could consider putting wellbeing champions in place. Is something that organisations do as well. So you've got people championing, you can say that, the whole wellbeing initiatives. And also, of course, and I'm going to say this because I am a mental health first aid instructor, you can think about training people to be mental health first aiders. And it's not a legal requirement yet to have a mental health first aider in the workplace. But I think once the government can stop focusing on COVID for 2 minutes, then it will almost certainly become a legal requirement. And that's because it's the right thing to do. We want that parity of esteem between mental health and physical health. So you have to have physical first aiders in the workplace. Why not have mental health first aiders? And that, again, if you invest in having mental health first aiders, it sends a very clear message that this is important and we care and we want to do something about it.
Very good. And I wanted to pick up on the piece there. You talked about wellbeing strategy, wellbeing initiatives in there. Of course, from your background and your speciality, you're really thinking about mental health. But I wondered, it sounds as though it's actually broader than that. It's about full physical, mental, social, economic well-being. Is that fair to say?
Yeah, absolutely. And I think the reason why we focus on mental health is because actually over the years it's been easier to think about physical health. It's easier for us to think about, I need to be getting more exercise, I need to be getting enough sleep, I need to be eating well, I need not to be eating too much cake or chocolate. It's easier for us to think about those things and know about those things. It's harder, I think, when we get into the realms of emotional and mental health. And so that's one of the reasons why we are talking about it a lot more and we're focusing on it a lot more, because it's not something that we've done until recently. You know, if I often say to my groups when I'm training, I go, well, let's start off by let's having a common understanding and agreement that we're all mental. Yeah. And, you know, you look at people's faces and you think, do they think I've just been offensive towards them? But the point I'm making is that mental health is part of being human. It's part of who we are. We are all mental because we have mental health. And unfortunately, the use of the word hasn't been particularly helpful over the years, has it? You know, if I said to you, oh, they're a bit mental, you think I was being rude. But if I said, I've had a mental week, you get, okay, that's great, that's good. That's a very positive use of the word. And so the language around mental health doesn't help either. And it's created a lot of stigmatism and discrimination, actually.
And you also spoke about the wellbeing champions, perhaps even mental health first aider champions in organisations. When have you seen that work really well? What are those champions able to do at a colleague level for the people that need help?
Okay, so when have I seen it work well? I've seen it work well, and there's been demonstrative evidence whereby they have recorded the number of conversations that people are having with their mental health first aiders, and some of those would have been mental health champions as well. And they've recorded how many they've had over a period of time. And they've been able to say, of those conversations, we know that there were a handful of people who were talking about suicide, and they had suicide plans in place. And so there were a couple of people where they were actually able to stop somebody taking their own life because they had a conversation at the right time with a mental health first aider that caught it at the right time, and that person obviously felt safe enough to open up about it. And what that organisation did as well, they were very clever in linking the number of conversations that they were having to absenteeism and sickness figures. And so by doing it that way, they were then able to say, because we invested in having all of these mental health first aiders and mental health champions, they trained their managers to be mental health champions as well, we have now saved this organisation £30,000 in sickness absent fees. And that, I think, is awesome. That is amazing.
Even if it could be a life which has got no figure on it whatsoever.
Absolutely, absolutely. Yeah.
So what about flipping it right on its head then, and thinking about the people that just do not want to engage with wellbeing initiatives? And we've all come across them, we know them, we really try and get everybody, high engagement. There will be some people that just go, it's not for me. What do we do with people like that?
So I think this is about knowing your workforce. So it's about conducting a survey, but only conduct the survey if you intend to action on the results, because the worst thing is that you conduct a survey and it all comes out that people are not happy and then you do nothing about it. So know your workforce, conduct a survey, find out what people actually want. So do they want a pool table or do they want a coffee machine? Don't put a pool table in if actually all they want is a coffee machine, because you've wasted your money and actually people won't engage with it. So know your workforce, understand what's going on, understand what they want, and also understand that sometimes it takes some time for employees to trust that they genuinely believe you really care about them. And sometimes it does take some time, and it takes some time for you to keep doing things over and over again so that they get, yeah, they do care about me, and they will start to open up and engage with it then. So,
but I guess there's also that piece around, if somebody doesn't want to engage, that's also okay, and you don't necessarily want to force that. Would you agree with that comment?
Yeah, I do agree with that. Yeah, we talk about this a lot when we're talking about mental health, because we say, you know, not everybody wants to talk about it. So let's not force people to do it. I say to my mental health first aiders all the time, you know, so we talk about, if people are in a crisis, then we need to break confidentiality and get them appropriate help. That's fine. But if they're not in a crisis and you've just spotted that things don't seem to be okay, but you want to go and have a conversation with with them, and they say, do you know what, I don't really want to talk about it right now. They don't really want to talk about it right now, and there's no reason to do so. And the only time it becomes a little more tricky is if their performance is dipping, and that's when it becomes harder, because you can't ignore the performance. But remember what I was saying before, the right thing to do is do your wellbeing review, find out what's going on, don't hide behind performance. And at the end of the day, if you're wanting to engage, you've offered to engage, you've offered to do whatever is required to help that person recover their well-being. And if they refuse to engage with you in that way, then you only have the performance to fall back on, of course, because you know, people are under contract to perform and deliver results for organisations. So
there's an interesting link to a question actually that's just come in from one of our audience members talking about well-being fatigue, and I thought I'd bring this question to you actually, Kathy. This person says that we've had feedback of well-being fatigue resulting from initiatives over the last couple of years. Have you got any tips for helping us to shift to a more engaging way? Is it just trial and error to find out what works for our culture, or is there something else that they can do?
Yeah, it's a good question, good observation. And I think there are organised, it's a bit like the pendulum, doesn't it? The pendulum swings so far one way when they decide, right, we really do need to take this seriously, so we're going to put some wellbeing initiatives in place, and then everyone gets a little bit, flipping out, I'm so overwhelmed with all of this. And I think it does come back to ask the question, do the survey, find out what do people actually want. And you know, it may be that you're throwing stuff at people that they're not engaging with because it's not really what they want. It's back to the pool table and the coffee machine. Find out what they want. And then I think you'll take the trial and error aspect out of that process.
Thanks very much. And again, I want to reach out to our audience members to gather their feedback. Again, I'm going to launch another poll, and I want to ask you, do you feel comfortable talking to your employees about mental health? And once again, we've got yes, very much, I feel very comfortable. Yes, a little, we're getting there. No or not sure. So do you feel comfortable talking to your employees about mental health? And we're getting the answers coming in thick and fast already. So thanks so much for everybody that's voting on this. It helps us to create some content here that's really relevant to what you really need.
Yeah, it's a great question to ask, isn't it? Because your audience on here, we've probably got some HR professionals on here, we may have some managers on here, and it's asking, do you feel comfortable talking to your people about mental health? And you know, HR, you're often at the sharp end, and everyone assumes that you know all the answers to everything. And I can't tell you how many HR people I have through my courses doing the mental health first aid training themselves, because they don't necessarily know all there is to know about mental health. And yeah, so and having managers trained as well is a great thing to do, because then they will get more comfortable having conversations about mental health.
Fantastic, thank you. So let's just pause that poll. Let's have a look at the results of what's come in here. So based on the question, do you feel comfortable talking to your employees about mental health? 48% say yes, very much. 40% say yes, a little. 8% say no. 4% say they're not sure. Again, Kathy, just to bring you in on those, what are your observations of those results?
It's very telling, isn't it, that you've got, okay, we maybe got half of the audience saying, yeah, I'm okay to have these conversations, but you've also got some people saying no. And maybe it'll be for another time, but the question is, why are people not comfortable talking about mental health? You know, what is it that's stopping you? Is it a fear that you don't know how to deal with it if people start opening up? And I think, you know, one of the challenges is that we think that we've got to fix people. We think we've got to make it okay. And so therefore, sometimes it's best avoiding the conversation altogether, because then we don't have to solve the problem or fix it. And one of the things that is important to understand is that people don't need fixing, particularly when we're talking about mental health. Actually, what they want is they want to be listened to, understood, believed, and then the only question then is, what can I do to help? That's it. You haven't got to fix it. You haven't got to come up with a solution. And, you know, I think this is the hardest lesson for us all to learn, because we're often paid to fix. That's our careers. That's what we're paid to do, to fix things and solve problems. So I think if you can get your head around that one, I haven't got to fix this. I've just got to connect, understand, and listen.
Very good. And actually, we've just got quite a personal question actually coming in the chat, and I wanted to get your advice on this, Kathy. This person says that they find it very difficult to ask for help. They've had panic attacks and felt very overwhelmed in the last 12 months. How can I help myself if I don't like to let my guard down to others?
Gosh, okay. So obviously it's difficult to give one-to-one support on that. I think a very general response to that to be with that, if you're not comfortable opening up, and there could be lots of reasons for that, maybe you're not trusting the people that you work with, or you're just not ready to do that, then know that there are lots of services available on the internet that you can tap into. So one of the resources that's currently available is something called the Hub of Hope. And so any of you can go and have a look at this, and I like it because it brings all the services for mental health services all into one place. So what I would say to you is, don't give up hope seeking some help, because there is help out there for you. If you don't want to talk to people, then okay, maybe ask yourself what it is you're concerned about, and it may be because you're concerned about being judged or discriminated against. I would say that look for the services. They are out there. There is a lot out there. And I know often people start with a GP and get frustrated because they can't get what they need from them. So don't give up. Go and have a look online. Go and have a look at the Hub of Hope. Go and have a look at the NHS now. Do a lot of services that you can tap into for free. So cognitive behavioural therapy, which hopefully we may get time to talk about today, they actually have a self-referral where you can go and tap into workbooks and free information that's available to you online, and you can work through that in your own time, and you're not engaging with anybody else. But I would just say, yeah, don't give up. Just, you know, go and seek out some help that's going to be right for you. And if the other thing I would say is that, you know, if you've tried counselling and you thought that didn't work very well, you know, sometimes we don't get on with the first person we meet, and sometimes counselling doesn't work the first time, but it's actually more to do with maybe you've not connected with that person. So go and find another one. Go and find a different approach, a different person. And I know that's hard, and there is some help out there for you, and there's that right person that can help you overcome whatever difficulties that you're experiencing there. So hopefully that's helped.
That's actually incredibly helpful, because not only hopefully that person can take some action away from that, I think other HR professionals, managers, organisational leaders on this call can take that and offer it to other people that they come into contact with a similar query or question or concern. But also I really wanted our audience members to go over something practical from this session. I think we've spoken a lot about different techniques and tools and tips that they can use, especially by embedding cultures and making differences internally. I wondered if you may take us through a practical session, better help manage some stressful situations that, you know, we can all face from time to time.
Yeah, absolutely. I love talking about this one. So I was talking about CBT earlier, cognitive behavioural therapy, and it is something that's quite widely used in the NHS to help people change the way they think about what's going on for them, because we know if they change the way they think, they're going to change the way they feel, and if they change the way they think and feel, they're going to change the way they behave. So I know you've got a handout that you can access on this one, so because I've got it here with me. So on the back of this handout, you'll see that we talk about the ABC model. And what this refers to is that we have this activating event, and you could argue that COVID is one massive, ginormous activating event right now. So you have something that happens to you, and then you start forming a whole load of thoughts about that event, or call them beliefs. And I can tell you now that a belief and a thought is simply a transient idea that you hold to be true. So if I say that again, you know, a belief or a thought is simply a transient idea that you hold to be true. It's a bit like believing in Santa Claus. And I'm not going to tell you whether it's real or not, but you know what I mean when I say we have a belief in Santa Claus. Now, whatever beliefs and thoughts we have has a consequence. So there's the C. So you've got your activating event, you've got your beliefs and thoughts, and then you've got the consequence of that. And that consequence will either be good or bad, depending on what it is you're believing. And in the trade, there is a list of what we fondly call stinky thinking. On this handout, it's called common cognitive errors, but we call it stinky thinking. And I'll just give you, and what time we've got, about 5 or 6 minutes, I'll just give you some examples of this. So let's say you are a perfectionist and you are someone that has what we call all or nothing thinking. So let's say you are asked to put a presentation together and you know it's going to last 2 minutes, but you spend weeks and weeks and weeks pulling it together because it's got to be just right. Maybe you're asked to put a report together and you know that it's just an exercise in report writing because no one's going to read it, but you spend hours and hours and hours on this report, dotting the I's and crossing the T's because you are a perfectionist. I know someone who said to me, I recognize this, Kathy, I'm a perfectionist. And he said, when I clean my car at the weekend, I take all weekend. I do it Saturday and I do it Sunday, and I get a toothbrush out and I go around the sills and I flick all the little bits out. I was positively twitching by the time he'd finished because I am not a perfectionist. And I did say to him, he said, oh, it drives my wife mad. Well, you might want to stop using a toothbrush, you know, just a thought. So we have the perfectionist amongst us where we've got that all or nothing thinking. We can do this overgeneralizing, where we see things as a never-ending pattern of defeat. So these are, oh, well, you know, I went for that promotion and I didn't get it. That means I am never going to get promoted. I went for that job and I didn't get it. I failed. That's it. I'm never going to get a job. Oh, you know, I started doing my couch to 5K and I didn't get past going from the couch to the I'm never going to be able to run. You know, you overgeneralize. I was bitten as a child by a dog. That means all dogs bite. So one of the lovely ones that I like is that you're walking down the street and your friend's coming towards you and you wave and they don't. So Rosie, what do you think? Your friend's not waved to you. What do you think?
Oh my gosh, I must be hated.
Yeah, I must have done something wrong. I must be hated. They don't like me. And so you start, there's the activating event. Your friend's not waved to you. The beliefs and the thoughts are, what was this conversation we had? Did I say something to offend them? Have I really upset them? You know, you start going down. Some people might say, oh, they just didn't see me because they should have gone to Specsavers. But let me tell you, the number of people I ask, the majority say, oh, actually, I'm going to go into ruminating and worrying about what I said. And the reality is you are mind reading because actually they just didn't see you. So how are we doing? I'll give you a couple, there's loads on this list. There's a few more. Oh, I like the should one, the should statements. So I should stop eating cake, I should stop eating chocolate, and I should get more exercise. And are you getting that I really want to do it? Yeah, probably not. And so when I don't do it, I'm now going to do a bit of self-flagellation and beat myself up because actually I should have done it. But actually now I feel really bad. I feel demotivated. I feel resentful. I feel angry. I feel frustrated. And if you should other people, then they feel the same because they don't want to do it either. If you should your kids, you go, you should clean your room. Do they really want to do that? Probably not. Is it going to end in an argument? Probably. If you simply change the should to a could, that opens up a whole different vista. If you say, I could go to the gym, could go today, could go tomorrow, it gives you more options, actually. It gives you more, it opens things up a lot more. So, and I could go on. How are we doing for time? Because I'm noticing we're a few minutes off.
Well, I wanted to bring in a couple of questions that we've had from our audience members, actually. So just some quick fire responses if possible. So my organisation, this is a question from an audience member, my organisation is growing quickly and has recognised the need for investing in wellbeing. I know you've mentioned mental health initiatives and recording the changes, but how do you record and gather the evidence in order to measure the changes?
So that last bit again, because I just missed it. How do you record? What was the last bit, Rosie?
How do you record and gather the evidence
of how effective a wellbeing initiatives is? Yeah. Well, it depends what it is to start with. So all I can do is give you examples of what I did in the past. So I had gym membership, for example, in the organisation I worked for. So I worked out how many people were using the gym. I worked out whether it was male or female, how long they were spending in there. I could turn that into statistics. I looked at how many people were engaging with the cycle to work scheme, for example. You can start looking at how many people, if you put an initiative is about, okay, we're going to organise running at lunchtime, how many people are actually going? Yeah. And then, so you can get some quite clever quantitative evidence from statistics. And I'm not a statistician, I hate stats, but there'll be people in your organisations that they can turn things into stats for you, and then gather the qualitative stuff, because the qualitative stuff has value as well. So speak to people and find out, how's this working for you? Gather the testimonials of what people are actually doing. That gives you a lot of information about what's actually happening. So hopefully that helps.
Brilliant. Very helpful, thank you, Kathy. So we're just coming to the end of our session now, but actually if you'd like to come stay on for a little bit longer, we're going to go through some of the questions that have come up in the chat, so please do stay on for an extra 5 or 6 or 7 minutes or so. That's absolutely great. If you can't, not to worry, you'll be receiving the recording just afterwards. So thank you for everybody for taking the time to join Kathy and I today and sharing. Kathy, thank you for sharing your expertise today. It's been invaluable and some of the real practical stuff that we can take away. I'll just remind you that we've got loads of free resources available in the handout section, which you can download and use straight away, which are also brilliant. As I mentioned at the start of this session, we really appreciate your feedback. So we've got a survey that will come into your inbox just after this, where it'd be great if we could hear your feedback at the end of today's webinar. If you'd like to speak to one of our health and wellbeing consultants at Westfield about sourcing wellbeing in your organisation, then do also get in touch. You can either contact us through our website, westfieldhealth.com, or by email, businessinquiries@westfieldhealth.com, or we've got a new form as well, which you can fill in and get in touch that way. So we'll pause there. For those of you that want to stay on, we'll be here. For those of you that got to hop off, have a wonderful rest of your day, and we hope to see you very shortly. So actually, Kathy, we've had a couple of questions coming in from the chat here, and we've got a number of people that are still online actually. So we'll just hop through a couple of these. So this person says that they're a small workplace, small workforce. How can we implement changes times? Sorry, how can we implement times in the week where we can encourage staff to take out their time collectively? We're noticing that some people are not taking lunch breaks or any breaks of any sort.
Yeah, do you know what? This week, actually, I was talking to a group about ideas around this sort of thing, and they said, you know, every week on a Friday afternoon, we always have a bit of downtime, and it usually involves cake and chocolate and things like that. And everybody knows it happens at a specific time. We just take an hour to check in and chat about stuff. It doesn't matter what it is, you know, and that's more like connecting with each other, which is very beneficial then to people's well-being. And everyone knows it happens at a set time and everyone gets involved. So this was actually coming from the managing director of a small organisation. He said, this is something that we do and we've been doing it for a while. So I think it's implementing that type of initiative. Don't make it a grand thing, but just make it something that is sustainable, that you can do it on a regular basis. And, you know, this business of people not taking, I'm looking at the questions now, was that something about people not taking lunch breaks? Again, that's culture. So, you know, if the manager doesn't take a lunch break, then the person who works for them will think, I better not take one either. So again, it starts at the top. It's a bit like culture is driven by, are you sending emails at 12 o'clock at night because that's when you're working? And therefore the people receive it because we're on 24/7 and think, right, I'm going to respond to it, or I better respond to it, and they get nervous about not responding to it. So again, it's the message that you send to your employees that says, well, you know, if you want to send emails out of work time, that's absolutely fine. There is no expectation that you respond to it. That's the critical bit, but that has to be said, because otherwise it becomes part of, this is how we do things around here. So how we do things around here is we don't take lunch breaks. So that's what happens. It becomes embedded and part of your culture. So it is taking a step back and saying, okay, sometimes you have to formalize it to start with. So let's formalize next week. Everyone is going to take a half-an-hour lunch break. That's it. And you've got to record it, because anything that's recorded, anything that's measured gets done. Anything that's measured gets done. So yeah.
In the diary, make it an event, lunch happening.
Exactly.
So
Yeah.
I've got a couple of questions about mental health first aiders coming through actually. So firstly, nice and simple, how do you actually become a mental health first aider?
Oh, that's easy. That's an easy one. So you go to Westfield and you say, I want to become a mental health first aider, and they will book you onto a course. Now, the courses at the moment are running online, and they have been for quite some time, as you might imagine, because of COVID. So it requires quite a commitment from you. So you do need to commit to doing some self-learning, which actually people find really enjoyable. So you do it in your own time. You get a manual. You get a great big there we go. One I have to hand. You get this massive, great big manual, yeah, which is, look how thick it is. So you get to do some, that's not to put you off, by the way, that's to show you how much great information is in there. So you get to do some prior learning, and there are 4 separate sections, and then you get to come and see me or one of my colleagues for a couple of hours, 2.5 hours usually, for 4 live sessions. And at the end of that, you are then qualified as a mental health first aider. As things start to open up, you might prefer to do it face-to-face, then in which case you book onto a face-to-face course, and that's a 2-day course. The other options are, if you don't want to go through the full mental health first aid training and you want to be a champion, you can do that in a day. And again, you can do that online, or you can do it face-to-face. Or if you just think, you know what, right now I just want a bit more awareness, you can do a half day with me and I'll give you a bit more awareness. Or if you are already a qualified mental health first aider, maybe you want a refresher, you can do that again in a half day. That's a great course, actually. I really like delivering that one. So that just reminds people how to be a great mental health first aider.
Fantastic. So, another question coming in just regarding that is that this person asked, do you have any advice as to how a mental health first aider or a champion might raise concerns following a conversation with a colleague in terms of confidentiality? So if they feel as though they need to raise it, if they feel as though they need to raise it to somebody more senior, are they allowed to do that?
Probably not, unless you feel there's a crisis going on. So it's a tough one, because there's obviously a concern for the person, but I think I would err on the side of caution. I would want permission from the person. If I was going to escalate it, I'd want them to know who I was going to speak to, and I'd want their permission to do that. If, however, there was a crisis, so let's say in mental health terms, a crisis would be someone's talking about suicide or having suicidal thoughts, then again, I would make it transparent that I would need to get them some help, but actually you can't keep a plan for suicide a secret. So you would need to escalate it to somebody, and better that you ask the person, who is it you would like me to tell, rather than rush off to tell everybody. So I think it's a challenge because of GDPR, and I think it's also a challenge because people genuinely want to do the right thing by telling people, but unless someone's in a crisis, then probably what they want is for you to listen, you to be there, understand, and to offer what help and support that you can. Hopefully that helps.
Yeah, I think that's case by case basis, isn't it, really?
Yeah.
So another question coming here about strategies and implementation. This person asks whether there are particular themes that will have the most impact on staff wellbeing.
Oh, is there any particular themes that have the most impact on staff wellbeing? I'm probably completely biased because I'd have to say, obviously, addressing mental health. I would say probably one of the biggest initiatives will be making it clear that holding a wellbeing review is part of normal management practice. I think that one will have the biggest impact. And is it the easiest to implement? Maybe. It depends how much training and how good your managers are, really. But I think sending that message that it's the right thing for managers to have wellbeing conversations will have the biggest impact on the wellbeing of your organisation. So otherwise I could start giving you a list of wellbeing initiatives, but you know, for one organisation, one thing will work really well, but because of the certain type of industry that they're in, and in another organisation, then something else will be more effective. So I think it depends, doesn't it? It depends.
It goes back to your answer, you know, earlier on about getting to know your people and asking them what they need and putting out some suggestions out there, you know, what is it about, and people almost ranking them. But I think that information needs to come from your organisation rather from a finger in the air kind of guessing game as to what strategies seem to be best for that particular group. Yeah,
absolutely.
And another question coming in, and we've still got actually hundreds of people still on the webinar, so this is great news. But someone asks, based on your experience in working in HR, how can HR professionals look after their own mental health?
Rosie, you've got to answer this one.
Well, it's interesting, and you know, I think from my personal experience, I've myself had a difficult year. I myself have suffered loss this year, but I also have a type of role where it's very people focused, very people facing, and sometimes I do have a feeling like I've got to be asking everybody else how they are. So it has a very caring kind of role in that. And I have to say that sometimes it is draining, you know, always looking out after other people when you yourself are struggling somewhat. So something that we do at Westfield, which I have to say has been a real lifeline in some cases, is that we do HR for HR, and we buddy up and we have coaching sessions with each other. Someone that you can really trust, and when you say you're fine, they will ask you 2 or 3 or 4 times, how are you really? What's going on? But actually for us, I think it's about making every employee, regardless of if you work in HR or sales or operations or finance, that we all feel as though we can bring our full selves to work. And when we're not feeling 100%, if we're feeling a little bit under the weather one day, that there is somebody that we can speak to. And we've also got mental health first aiders and champions, and they're a wonderful group. And again, they're people that I feel as though I could talk to as an HR professional and as a friend as well.
And you know, I think to summarize everything that you've just said there, I know it's a little bit cheesy sometimes to use this analogy, but it's when you're on the aeroplane and they give you the safety drill, and they always say, don't they, that you know where your emergency exits are, know where the lighting's going to be, and when the oxygen mask pops down, put your own on first. And so I think, as you say, Rosie, it doesn't matter whether you're in HR or whether you're in finance or wherever you are, you know, self-care is so important. Self-care is about self-preservation, particularly at the moment. So, and I think we spend so much time looking after other people, looking after our families, our children, our elderly parents, and we forget that we are important too. And if we can't put our own oxygen mask on and think about our own well-being, 1, we're not teaching our children to do that, and 2, we're not taking care of ourselves. And when we keel over, then that's not great. And I think the other thing for HR, remember, you're not counsellors, you know, and I think sometimes the boundaries get blurred and we are in danger of rescuing people or trying to fix people. And, you know, the boundaries are blurred when you're starting to feel overwhelmed, because maybe you are that person that somebody trusts, and so they're coming to you all the time. Well, maybe you're needing to signpost them to get help from somewhere else. Maybe you would have an employee assistance program, for example, in your organisation that you can recommend that they go and access, rather than you taking it on all for yourself. And I think finally, with what Rosie says, having your own support network, having that person that you trust that you can go and speak to, that's going to give you a hug when you're not in a good place, is the right thing to have. So
wonderful. Well, Kathy, I think we'll pause there and stop this webinar for now. But do you know what a refreshing conversation? It's great to celebrate and mark Mental Health Awareness Week by talking to you, getting some expert advice, and being able to share that with the many people that have joined us on this conversation today. So just as a small reminder for the people that are still on here, check out the email that's coming. We've got resources, we've got links, we've got all sorts of different things on there. We've got our Coping After COVID report, which has got some amazing stats that, again, start to kind of bring to life the impacts of mental health and why it's so important that we really need to start talking about it. We are all mental, to quote Kathy Lawson.
There you go. Fantastic.
All right, thank you for joining us, and thank you so much, Kathy, today. So I'll see you on the other side. Bye-bye.
Bye-bye. Bye.